Hello everyone, I'm Leslie Cornwell, Certified Nurse Midwife with Empowering Midwifery Education. This next section has to do with staffing options for a women's health clinic. A legal disclaimer we put at the beginning of all of our presentations. This information is for general and educational use only, not intended to substitute for professional, clinical, or legal advice. We strive to keep our information as accurate as timely as possible, but make no promises, guarantees that it works for your unique situation. Course objectives. This section we're going to talk about exactly what is the staffing, what are the different job roles, why is it important to really have a key foundational team from the beginning of your practice starting and ultimately your end game of where you want to be. What are the different roles and responsibilities each person on your staff will have? What are the different steps to getting those people on your team, determining who you need first? How do you prioritize? How do you budget for it? How do you figure out who needs to be on your team from the beginning until your ultimate end game? So this topic is important because there's a huge staffing shortage. Midwives sometimes feel like they can just do everything and then they'll hire people later, and I really strongly encourage midwives to think like a business owner, not as much self-employed. I want you to make systems, I want you to make operations, I want you to hire and leverage the experts around you. Your time is too valuable to be answering a phone call, to be making marketing campaigns, to be following up on insurance claims. We need to be getting these excellent people on your team so that you can be the midwife, you can be the business owner, you can have a good work-life balance. So there's different activities each person on your team will do, and it's very important to have clear job descriptions, training programs, roles, responsibilities, chains of command. You really want to have in your practice a good sense of everybody is filling a specific task and role, and they work together integrally, and everybody can support each other well. If there's somebody sick, if there's somebody needing some additional resources, you have a big marketing project, you have a big influx of patients, you need help with registration and intake, you've got a bunch of patients you've been seeing, you need help with billing support. To have a clear understanding of cross training and core roles everybody's going to have. So you're going to want to talk about the different members of your team, what they're going to do. Are they going to be part-time, full-time? Are they going to be contracted? Are they going to be outsourced? Are they going to be on site? Are they going to work remotely? What's their day-to-day operations going to be? Are they going to work on projects on their own timeline? These are things that are really important for you to think about. And performance standards, expectations. What do you want them to do? You want them to know your mission really well. You want them to be hard workers, good work ethics, creative, take initiative kind of people, and that's part of the hiring process to find those great people. And then your job is to keep them motivated, keep available resources and tools for them to be successful. So the different people, the different functions of the staff, it really varies depending on if you want to start a women's health clinic that's a very small scale, 2 days a week. You're going to have very different staffing. Then you've got 5 providers and you're open 5 days a week. You're an urgent care, you're a primary care office, you've got a niche service. Everybody's going to have different levels of who they need from day one, but there's still very core roles everybody's going to need to have filled with their women's health clinic. So you want to look for qualified, competent people. You want to find, you either can hire them yourselves, you can get a recruiter. Maybe the first person you're going to hire is your office manager, and then your office manager is going to learn really well your mission, your services, your company, and then your office manager is going to be the one delegated your human resources responsibility. So it just depends on your goals and how big you want to be. So the different staff on the team, you want to look at people that are hard workers, very passionate. They're going to grow with the company as the company grows. Your women's health clinic, maybe you hire some nurses that eventually will be midwives, nurse practitioners on your team. You hire receptionists, office managers that are doulas, childbirth educators, lactation consultants that are finishing nursing school. They're going to be birth assistants. They're going to have multiple roles within a practice. So with a women's health clinic, it's really great to find people that live and breathe your mission, your services, your advocacy, because that's going to go leaps and bounds when they're on the phone, when they're in front of clients, when they're promoting where they work. you really want them to be happy and passionate about what you're doing. So you want to look at people to join your team that are maybe you have to train them in certain skills, but I always recruit based on passion, good work ethics, hard workers, responsible, respectful, those key traits, and then I train on the additional ones. So you're going to want an office manager, you're going to want a receptionist, you're going to want, depending on how many providers, if it's just you, if it's adding a nurse practitioner, if it's another midwife, you could add physicians to the team. It depends on what services you really want to offer, but you definitely want some key people from day one so you're successful. So there's different steps in hiring people. You want to look and plan. You want to be wise in what are your budgets? How are you funding the practice getting started? How long is it going to take for clients to be seen, to get revenue coming in? The nice part with the women's health clinic, you don't need as much cushion for overhead expenses for human labor as you do compared to a home birth center practice, because you can start seeing people as soon as the door opens, and you do an office visit, you get typically paid 10 to 14 business days later, versus a maternity care focused is you see them for 6 to 9 months, then they deliver, and then you may take 2 to 4 months to get paid because it's a larger claim and it's more complicated. So there's advantages to making sure, who do I need for staff? I strongly encourage a midwife, no matter if she's big or small, to hire a receptionist and an office manager from day one. Make sure your budgets account for that, your fee schedules, your planning process, because they're going to be vital in helping you to expand and grow and create systems and handle the influx of new patients coming, work on projects for you. They're great people on your team for delegation, so you can focus on planning for the business, taking care of patients. Sometimes adding a medical assistant, a registered nurse might be wise from day one, because they can help a lot with ordering ultrasounds, labs, testing, following up on things, tests, communicating with patients if you're in a visit. So there are a lot of benefits depending on the services you're offering to also have a medical assistant or an RN from day one. So you want to look at your recruitment process. You want to use Indeed, ZipRecruiter, go on Facebook, talk to your warm market. How do you want to find these great people? When do you want them to start? How long of an orientation process? What resources do you have in place to train them? A lot of times from the beginning, they're also going to be side-by-side training for their job, but also creating the training policies, manuals for themselves and the new people adding to the team, because it's a brand new practice. So the stages, the development, okay, for the first 3 months, we're just going to have myself and an office manager. The office manager will answer the phones, and then at 3 to 6 months, we'll add a receptionist, we'll add a medical assistant. You've got very specific stages based on budgets, based on objective. This is, I want to add this staff once we hit this patient new intake volume. When I see this many people in the office average the last month, you've got objective quotas to explain when you're going to add and transition more people. A lot of times the first few people you add are going to be trained in practically everything. That's why it's nice to add the office manager, because as you grow and you get more specialized job descriptions, the office manager's done everything already, so they can train the additional people coming on to do billing, to do marketing, to do reception, to do a lot of these things within the practice. An appraisal process has to do with getting the value sense of how much is it going to cost for that person to be added, how much does an office manager cost, how much does another practitioner on the team, a biller, a marketer, what am I going to have to budget, what is the going rate, can I do it full-time, can I do it part-time, is it a commission for the biller? You really want to determine the step-by-step chain of who you need to add, being very clear job descriptions and expectations of them, because you want them to stick around long term. You don't want to invest a bunch of money. It's very expensive to have a high turnover of staff. So it's really important to have clear expectations, them to really understand your mission, and that they're invested in the long haul. They're not going to be temporary staff. They're not going to just do this till they're finished with school and move on and do something different. So there's different type of employment statuses. I want just high level, we have more discussion questions and details with other presentations, but I want you to understand hiring staff doesn't mean necessarily they're full-time benefited traditional W-2 employees. You could have 1099 contractors, you could have remote workers, you could have people outsourced that have their own companies, particularly with the billing and the marketing side. You could have a virtual assistant practically anywhere in the world. So I want to challenge you that there's variations of staff. You don't have to just think about who am I going to have on site the days I'm there running the day-to-day operations of the clinic. Who is also the support staff to work on projects, to work on marketing, social media, branding, claim processing. They could be remote, they could work on their own timelines. There's more flexibility in some of these different roles. So you want to think about that, especially when you're negotiating with them. What roles you have to have on site, what roles would be nice to have on site but don't have to be. Maybe you don't have the office space for them to sit as a marketer or a biller in the office, so it makes sense for them to work from home. And talking about what positions you want to have benefits for, what positions you don't want to have benefits for, you can offer them insurance, retirement planning, health savings accounts, flex spending accounts. You can do bonuses. You can do practically anything you want to do part of your benefits. You just have to be consistent with all your full-time staff. Providers, you tend to have to pay for continuing education and licensures and registrations and all these extra things to continue to practice and do their role. So you have to think about that when you're hiring and making your staffing, and what qualifications. Do you want somebody that's a new grad? Do you want someone with experience? Do you want someone that is maybe they're going to be a learning curve of this role, but they've got a lot of attributes and alternative therapies you're looking for with your women's health clinic. So you just have to determine the skills and qualifications of what you're looking for, and what are you willing to train, and what do you want them to know from day one. So this is the different staffing options for a women's health clinic. There's no right or wrong answer. I just challenge midwives and business owners, when you're opening a practice, a midwifery practice of any kind, you want to leverage the experts around you. You are excellent at the mission, the vision, the services, what you want your practice to offer. Your role, your best expertise is putting the systems together, getting that great team, getting the resources so you can serve the families on a larger scale. So obviously a midwife, a nurse practitioner, a physician, a provider of some kind that's going to directly provide the care at your women's health clinic. You could offer multiple services. Midwives are based on a national certification of being independent care providers. They can do birth, they can do pregnancy care, they can do postpartum, newborns the first months of life, gynecological services, primary care for women. So challenge yourself. You can make a teenage contraception clinic. You could make an abortion clinic. You could do hormone replacement for postmenopausal women. You could do pelvic floor therapy. You could do primary care, urgent care. There are so many services and things your women's health clinic can offer to the community. The limit is only your creativity. So I do challenge you to see what are the needs in the area, see what you're passionate about. Maybe there's some needs, but it's not your passion, it's not direct care you want to offer. You can hire someone to join your team. You look at the number analysis of that service, overhead expenses, need in the area, what is the fee schedule that you can get reimbursed, and does it make sense to add that to the practice? You definitely want to have good collaborating relationships with physicians, practitioners, healthcare systems in your area for ordering ultrasounds, labs, testing, people that risk out of your low risk healthy care. Additional specialties, maybe you notice an abnormal mole, you want to know a dermatologist in the area. She's got urinary incontinence, you're going to see her, you're going to work closely with a women's health physical therapist in the area. So part of women's health clinic, and this would be great, you can network, you can promote your services and get those cross referral relationships built. You can also have your marketer do that. You could have your office manager, you could have another practitioner on your team go out and do some community outreach. There's a lot of great ways to get those services and those relationships built up. So nurse practitioners are other people you can add to the team. There's women's health nurse practitioners, family nurse practitioners. There's so many different specialties you can add depending on the services you want to offer. So I always challenge midwives and birth workers in practices, what do you want to offer? Who makes the most sense? And what are some cross skills? Like I talk about a lot with the maternity care services, it's amazing for a midwife to add a family nurse practitioner to their team because now they can take care of the babies after the first month of life. Now they can take care of the male partners that haven't been established with a practitioner because they're looking for somebody alternative friendly. You could have a women's health nurse practitioner on the team that can help with, you all of a sudden have to run to a birth, you don't have to reschedule all your patients. You can now have the nurse practitioner, the provider that's in the office, help you with seeing those people. So there's a lot of benefits to growing a team as soon as you can versus being solo, because when you're solo, you're still self-employed, you're still exchanging your own time for money. When you build a team, you go on vacation, your nurse practitioners, your midwives, your providers are still seeing patients within the clinic for you, and revenue is still coming in. So there's a lot of great things to think about. Just depends on really what kind of services you want to offer in your practice. So a nurse is really helpful. A medical assistant, a nurse, they can have very similar roles. They can do informed consent. They can set up rooms for you. They can clean up. They can help with ordering supplies. They can assist with procedures, IUD insertions, Nexplanons, colposcopies, anything you're needing more of a sterile and some extra hands for. They can be an intake for phone calls with medical questions to your office while you're in a patient's room and you're not in that day. They can follow up on labs and ultrasounds and testings. They can touch base with you to see, hey, this PAP was normal, can I call the patient? So there's a lot of day-to-day medical support that a nurse can give the provider that's really helpful. The receptionist is a great vital person. You're going to want to hire somebody really warm, friendly, bubbly, because they're the first impression most of the time of your practice when someone calls. So you really want to be picky when you're picking your receptionist. They're going to be in the waiting room chatting up with your clients. They're going to be talking to them on the phone and following up on things and making appointments. So this is a very, very vital role, especially in a women's health clinic, because you have a lot more patients coming through day to day. And the phone calls are going to be a lot more than a traditional midwife, birth center, home birth practice. So they don't have to have any specific prior skills and qualifications. I really push for somebody that's very passionate about our mission. They're going to be around long term, and they're just so warm and kind on the phone. Those are the big attributes I look for. And then you can train them based on the job description you want them to have. Do you want them answering the phones, taking patient intake information, triaging phone calls to the practitioner, the nurse, to the marketer, the biller? There are so many different things that receptionist is doing, being on the front line. They're having people fill out paperwork as new intakes. They're really just answering questions if people call and are curious and want to know more information. It's a very multifaceted job and fast pace. The office manager is a really, really important role. You want someone that is a good critical thinker, leadership skills, can handle multitasking. They can handle challenges coming at them quickly that need to be changed over and switched in responsibility. They have to know how to do every single person's role within the organization. If someone calls in sick, they may have to be the one filling in temporarily. They're the one training staff, hiring staff. They know really intimately your vision, your mission, your strategic plan of where you want to go, and they're going to help implement the day-to-day operations of making that happen. So your office manager and your receptionist, I would say, are the big key people. You have to be very careful of hiring the best of the best. They're your front line, they're your make or break of your women's health clinic being successful. The medical biller, this one can be on site. Typically, it's remote, it's outsourced. Medical billing is super complicated. It depends on your volume. If you're a small scale practice, it may or may not make sense to train someone in-house to do that for you. Large scale practices, it may make financial sense to have a part-time, full-time biller that does your practice and is trained in your procedure codes and services and the insurance companies that you work with. So you just have to do a cost analysis, because the claims change, the regulations change, each insurance payer is different, the follow-up. There's a lot of really key skills you want of people that are very detailed oriented, people that have a background in medical and billing training, qualifications, because they are in charge of your financial revenue stream. You can do a practice boutique and cash if you want, but most women's health clinics will get in network. They'll be part of the Affordable Care Act, so they can offer a lot of gynecological preventative services, well woman maintenance things that many other midwives just don't offer. And so having a medical biller that really can be on top, they can bill out as soon as the service has been rendered, they follow up promptly with additional documentation, they get out statements right away to patients when there's copays, there's deductibles, it's a non-covered service. They're the frontline discussion person about finances with patients, determining the collections protocol. So they're the ones that handle your financial revenue stream. So you really, really want to have a great biller either on site or outsourced. A marketer is really, really important. You could have the best practice and services and care in the world, but if nobody knows you exist, it does not matter. Let me repeat that again. You could have the best thing since sliced bread, but if nobody even knows you exist, it does not matter. So you want to be on social media. You want to do open houses. You want to be branded as the expert in your community. You want to get to know the referrals, the collaborations, people that you can cross-refer people to. So think of your services, your philosophy, your viewpoints, chiropractors, naturopaths, primary care offices that are private, small mom and pop medical practices are really important to collaborate with. Doulas, people that are around your ideal clients all the time. So homeschooling groups, mom and so like even like a health food store, a homeschooling co-op, like there's so many great ways. Once you start getting more and more established, your happy customers, patients you're taking care of will be referrals, will be your marketing campaigns. As time goes on, as long as you're not growing and expanding, your marketing budget and your marketing needs will get less and less of a demand. But as you continue to grow and expand and rebrand yourself, add new services, you really want to get a strong professional reputation in the community, and it takes time. You could do radio stations, you could do flyers, brochures, you can go talk and do events that you invite people to. You can go to church meetups. There's so many things you could do and the marketer could do that's cost effective based on your budgets and knowing your goals and where you want the practice to go. A marketer is a really, really important part of your team. Even if they're outsourced and they just work in the beginning a few hours a week, you want to get going slow and steady with marketing is much better. You don't want to put a ton of money and time and then don't do anything for 3 to 6 months. You don't write any blog posts, you don't do anything on social media, and then you do a bunch and then you don't do anything. That looks way worse than just once a week I'm going to post something on Facebook. Once a week I'm going to do XYZ. I'm going to reach out and have coffee with a local provider and get to know their services. So a marketer is a really, really important part of your team to bring in new patients. So I want you guys just to think about with your practice, with the services you're going to offer from day one and where you want the practice to go, your first people you hire are going to have a ripple effect on the rest of your staff, the culture, the mindset, the work ethics, the quality of care that your practice brings isn't just what you do in front of the patient. It's every step of your practice. It's how they're talked to on the phone. It's how the office manager handles inventory, how they handle training, how they handle conflict resolution with an unhappy patient, how the team works as a whole to support each other with those quieter and busy days so that clients can be seen faster, the services can give high quality care, there's no misses, the procedures are done safely and accurately, there are good step-by-step integral communication to the marketer, to the biller, to the office manager, to the practitioners, so that everybody is getting that high quality care and the mission and vision of what your practice wants to look like.